Chapter 3, Basic Medical Terminology, the Human Body, and the Cardiovascular System. By the end of Chapter 3, you should be able to define word elements such as roots, prefixes, and suffixes. Combine elements to make words and divide complex words into these elements. Define basic terms used in the laboratory and examples of testing performed in the laboratory. Describe the basic functions of the major body systems. Describe the basic functions of the cardiovascular system. Identify chambers of the heart and major heart blood vessels. Distinguish the characteristics of arterial, venous, and capillary blood. Distinguish between whole blood, serum, and plasma. Locate the veins most commonly used for phlebotomy. Define hemostasis and list 5 basic steps in the coagulation blood clotting sequence. Define hemostasis and list 5 basic steps in the coagulation blood clotting sequence. Basic medical terminology. Word elements. Root word is the main part or the description. Prefix is added before the root word. Suffix is added after the root word. Combining vowels added to make a word easier to pronounce. Word elements in medical terminology. Prefix examples pertaining to position, location, direction, or placement. Ab, away from, ad, toward, ana, up, ante, before, cata, down, circum, peri, around, endo, within, innermost. Please see Table 3-1 in the textbook. Suffix examples pertaining to pathologic conditions. Algia, dynia, pain. Cele, hernia, tumor, swelling. Emesis, vomiting. Itis, inflammation. Lysis, destruction, separation. Megaly, enlargement, large. Oid, resemble. Please see Table 3-2 in the textbook. Rules for combining word elements. Tips on pronunciation. CH sounds like K, for example, chronic. PS sounds like S, for example, psychology. PN sounds like N, for example, pneumonia. Tips on pronunciation. C sounds like a soft S when it comes before E, I, or Y, for example, cytoplasm. G sounds like J when it comes before E, I, and Y, like generic. I sounds like I when added to the end of a word to form a plural. Bacilli or bronchi. AX to aces, as in thorax to thoraces. NX to GES, as in phalanx to phalanges. EN to ina, as in foramen to foramina. IS to ES, as in crisis to crisis. IX to ICES, as in appendix to appendices. On to A, as in spermatozoon to spermatozoa. To A, as in ovum to ova. US to I, as in nucleus to nuclei. Y to IES, as in artery to arteries, or phlebotomy to phlebotomies. Anatomical terms. Anterior, the front of the body. Posterior, towards the back. Medial, towards the midline. Lateral, towards the sides of the body. Distal, away from the center point of attachment. Proximal, near the center point of attachment. Superficial, near the surface of the body. Internal or deep, far from the surface of the body. Terms related to body orientation. Terms related to body orientation. Body movements and locations can be described in terms related to imaginary planes that divide the body. In Figure A, the sagittal plane midline divides the body into 2 halves. In figure B, the plane that divides the body into the front and back is referred to as the superior inferior plane or cranial caudal plane. Body positions. Normal anatomic position: erect, standing with arms at rest with palm facing forward. Supine, lying or reclining face up. Prone, lying face down. Lateral recumbent, lying on left or right side. Here are your reclining positions. Major organ systems. Disorder, any pathologic condition of the mind or body. Disease, specific, measurable condition characterized by specific clinical symptoms, patient history, laboratory or radiology results. Illness, subjective, non-measurable term for any departure from wellness. Homeostasis, steady state, balance and consistency of chemical components, temperature, pulse rate, and respiratory. Homeostasis is the steady state, balance and constancy of chemical components, temperature, pulse rate, respiration rate, and blood pressure. Monitor normal functions through laboratory analysis. Please take a minute to look at figure 3-4. It is the organ systems of the body. Laboratory test panels. Basic metabolic panel, comprehensive metabolic panel, cardiovascular screen or lipid profile, electrolyte, lights, hepatic function panel, liver, hepatitis panel, acute, renal panel, kidney or urinary. Cardiovascular system, transport network affecting every part of the body within seconds. Transport cells, H2O, electrolytes, hormones, enzymes, antibodies, nutrients, gases, O2 and CO2, etc. to all cells of the body. Aids in body defense, temperature, and blood coagulation. Consists of the heart, arteries, veins, capillaries, and circulating blood. In figure 3-5, we have the internal anatomy of the heart and path of blood circulation. In figure 8, this is a diagrammatic frontal section of the heart showing the major structures. Numbers indicate the path of blood flow through the heart. In figure B, the path of blood flow through the body. Arteries are red in color. They carry oxygen-rich blood, oxygenated, from the lungs and heart to the upper and lower body. Most veins carry oxygen-poor, deoxygenated blood from the upper and lower body back to the heart and lungs to pick up more oxygen. However, pulmonary veins carry O2-rich blood back to the heart from the lungs. Also, only the pulmonary arteries carry O2 poor blood from the heart directly to the lungs. Here is a comparison of the arteries, veins, and capillaries. In figure 3-7, we have the venous system of the upper torso and arm. The antecubital area of the arm is where venipunctures are most often performed. It is the area where the arm bends. The median cubital vein is the best for venipuncture because it is one of the largest veins. It is close to the surface of the skin, has a layer of antecubital fossa to protect the deeper arteries and nerves, and is well anchored so it does not move or roll as easily as the other veins. In figure A, a major arm veins on the right hand, palm up. In figure B, variations in venous patterns. Because all individuals are unique, the exact location of veins may vary from one person to another. This figure depicts variations in venous patterns in the arms of two individuals. Veins of the anterior and posterior right leg. The femoral vein is a deep vein. Note that the greater saphenous vein is the longest vein in the body. It ascends up the medial side of the leg and the medial thigh and empties into the femoral vein in the groin area. The lesser saphenous vein comes up the lateral side of the ankle and enters the deeper popliteal vein behind the knee. In figure 3-11, we have preferred site for venipuncture. In figure A, the preferred site for venipuncture is the antecubital area of the arm. In figure B, we do not use the wrist for area for venipuncture. In figure C, if other preferred sites are not available, use the back posterior side of the hand. Blood. Circulating blood essential to homeostasis and sustaining life. Made up of liquid portion, plasma, and cells. Erythrocytes, RBCs, red blood cells, transport O2 and CO2. Leukocytes, white blood cells, WBCs, are for defense. Thrombocytes, the platelets, are for clotting. Please see Table 3-8 in the textbook. Human blood cells consist of 3 types: white blood cells, neutrophils, eosinophils, basophils, monocytes, and lymphocytes, red blood cells, and platelets. Erythrocytes, or red blood cells, RBCs. Note the characteristic red color and their unique donut shape. Each RBC has a depressed center, and when cells from normal circulating blood are analyzed, no cell nucleus is present. Hematopoiesis, blood cell formation. All cellular elements of the circulating blood found in veins, arteries, and capillaries begin in the bone marrow, as shown in the light yellow-tan background. Blood cells are considered immature when they are in the bone marrow and mature when they reach the circulating blood. For example, mature cells can carry out their intended functions of carrying O2 or CO2, RBCs, providing immunity, defense, WBCs, or helping in blood clotting, platelets. Note that the pink background area represents the circulating blood. Hematologic analysis in the laboratory of blood and/or bone marrow samples can reveal cellular abnormalities. For example, if there are too many or too few of any one cell type, if there are too immature, or if they are abnormally shaped. Plasma, the liquid portion of the blood. It transports constituents in the bloodstream. If anticoagulant is added to the blood specimen, coagulation clotting is prevented, and specimen can be centrifuged, resulting in a layer of cells and the liquid plasma. Serum, if blood specimen is allowed to clot, resulting liquid portion changes from plasma to serum, plus blood cells are meshed in a fibrin clot. Serum contains same chemical constituents as plasma, except clotting factors and blood cells are contained within the fibrin clot. Blood specimens with and without anticoagulant before and after centrifugation. Homeostasis, maintenance of circulating blood in the liquid state so that it does not clot spontaneously. Body's mechanism to prevent blood loss. Hemostatic process repairs the break and stops the hemorrhage by forming a blood clot. Blood clot. These strands of fibrin trap many erythrocytes to form a blood clot or thrombus. Homeostasis overview. Coagulation phases. Vascular phase, platelet phase, coagulation phase, clot retraction, fibrinolysis. Coagulation issues. Use slight pressure over the puncture site to stop bleeding. Some drugs may cause a patient to bleed for a longer period of time. Make sure bleeding has stopped before leaving a patient. Some medications prolong bleeding after a venipuncture. Types of bleeding. Arterial, bright red in color, quicker, occurs in spurts, harder to control, requires assistance. Venous, blood dark red in color, steady flow, easily stopped by applying gentle pressure. Capillary, occurs slowly and evenly due to lower pressure and small size of capillaries. Easily controlled, sometimes stops without intervention. Blood color between that of arterial and venous blood. That is the end of chapter 3. Thanks for watching.